Heart failure is an enormous problem for medicine and hospitals in general, but especially the emergency department, because we're the first stop for people who are in distress.
CMS is decreasing reimbursement. It's really important for the hospital and institution to streamline that so that we're not readmitting or we're going to lose money.
And if you lose money on one of your biggest admissions to the hospital, you're going to have a hard time staying open as a hospital.
So from a quality of life to a resource expenditure, there's great impacts.
I created the idea of a multidisciplinary heart failure clinic whereby the physician could team up with the other healthcare professionals and try and troubleshoot a lot of problems at the same time. So an emergency room physician in a remote facility has a patient present with a shortness of breath. He pulls up our acute heart failure order set. He follows the directions looking at impedance cardiography, looking at cardiac index, cardiac output, vascular resistance, stroke volume, that gives him an immediate gratification in terms of what he's dealing with. Is this pulmonary? Is this cardiac? Is this fluid overload? And he therefore has both a diagnostic toolkit as well as a treatment toolkit in which to initiate therapy. Whilst heart failure remains still somewhat of a bedside diagnosis, the BioZ machine was just a very quick, instantaneous way to be able to get that information to hand immediately.
It's very non-invasive, has no pain involved. It's very simple, very fast.
So if a patient is either hypotensive or suddenly short of breath, within 5 minutes I can respond, react, and instigate new treatment strategies. That is very useful.
We use it in our outpatient clinics all the time, and we use it in the hospital as well.
In a nutshell, the ICG devices are helping diagnostically, they're helping in the early, immediate therapeutic intervention.
It gives you a feeling that you're not just guessing, you're using scientific knowledge to help you make a decision on how this treatment should be used in this patient.
And one of the attractions of impedance cardiography is that it parallels the information that we get from a right heart cath.
And so when we got this tool, we recognized very quickly that we weren't going to have to put people through all this invasive technology.
The number of right heart caths we do now has been reduced by something like 90%.
Five years ago, everybody with heart failure got admitted. Now we can help quantify a little bit more accurately how bad their heart failure is.
And it became very clear that we could usually send the patient home within 24 to 36 hours. And patients love that.
So that in itself and decreasing our readmission rates has benefited the hospital in a great way.
The big picture is to keep them out of the hospital, keep their standard of living high quality.
At St. John's, we've just got the lowest 30-day readmission rate out of 127 hospitals in Illinois.
With Dr. Jennison and with our heart failure team, it is amazing to see what one person with a burning passion can do and how somebody who is part of a private group can influence the care of an entire community of physicians by setting up a team of folks that are hospital-based, not physician-based.
It's affected our reputation in a great way. It's basically shown us that we can strive to be one of the best programs in the nation.